Welcome back. You're still watching NTV Weekend Edition. Let's continue by looking at how Uganda currently has 11 vaccines on its routine vaccination schedule. Among these include measles, polio, hepatitis B, among many others. Now, through the Ministry of Health, the government of Uganda routinely carries out immunization of eligible children. The eligible children across the country access the vaccines from the different government health facilities spread across the country. However, during this period of the COVID-19 pandemic, public and private transport has been restricted and is still absent in the border towns. A number of new measures of social distancing have been introduced and continue to be applied across the country, including in the health facilities. But we wonder tonight how this has affected the government's immunization programs. And speaking to us in regards to this, we speak to Fred Nsubuga, who is the Senior Medical Officer in the Ministry of Health. Welcome to our studios tonight.
Thank you.
Well, we know that children below the age of 5 have a vaccination schedule. With the current pandemic, how has it affected the immunization programs?
Currently, the pandemic has significantly affected our immunization schedule. You recall that the country went into lockdown suddenly, and in that many health workers went in their workstations. So the few ones who were available were repurposed to respond to COVID, leaving our vaccination services unattended to, or with minimal health workers to attend to the clients. Actually, if you look at only 2 vaccines, one DPT and the other is measles, look at our DPT1 coverage, which really assesses access of vaccination services. You find out that currently we are at around 79%, and any coverage below 80% is poor access. That means children are not accessing our services, and therefore we are likely to get vaccine-preventable diseases. Secondly, when you look at our measles rubella, measles is one of the highly infectious diseases. You again see that our coverage currently is at 67%. Again, that is very low coverage. Any coverage below 95, you are likely to get out of outbreaks. We have also had other services that have been postponed. You remember we had an outbreak of yellow fever in January, and the minister recommended a reactive campaign. We are supposed to have that campaign conducted in April, but because of the lockdown, we never had that campaign up to now. We have other interventions like integrated child health days. These are interventions that mainly help us to reach the children who have not been vaccinated as yet, or those ones in hard-to-reach areas. And we also use integrated child days to do other interventions like mabendazole and then vitamin A. All those ones were not conducted. We also use them to do vaccination for young girls at 10 years, hepatitis, for cancer of the cervix. That one was also not done. So you see that has been significant disruption of our vaccination services. All
right, you seem to actually agree that the COVID-19 period has affected this particular immunization program as well. What are some of the strategies that you have in place to deal with the disruptions caused by the COVID-19 pandemic?
Currently, the government, the ministry has issued guidelines to all districts regarding continuity of essential health services. And these guidelines help to ensure that the clients who are using our services and the health workers are safe. You remember that one of the challenges which we are facing is risk perception. People think that when they come to utilize our services, they'll get the COVID. So what we are trying to do is that we have oriented the health workers, the district managers, and the national technical persons to start using these guidelines. They can be used by both public and private facilities. And they show you how you need to work around to ensure that both the consumer and the provider of services are safe. So right as you come into our facilities, we ensure that you are screened, there's screening and triage. There's social distancing, we ensure people do hand washing. And as you come in our facilities, we make sure that the health workers have masks, they have PPE with them. We have provided areas, spacious areas with good ventilation where people can sit, and then we regularly disinfect these surfaces to ensure that our clients are safe. But also, we make sure that the social distancing in whatever you do, so that the patient or the client feels safe and that they can come again
so
to utilize the
for
services.
the parents watching us, for the mothers and the parents watching us tonight, they shouldn't worry to come to the health facilities to get these immunization vaccines, is it?
Yeah, really, what we have done, we've made sure that we conduct daily vaccinations in all facilities which have refrigerators. But also those ones which don't have refrigerators, we are encouraging the health workers to go and pick vaccines from those facilities that have fridges. In that way, we shall have fewer people coming, because now we have vaccination occurring daily. Therefore, there's no need of having many patients, many clients coming on one day to get the vaccine.
Well, there's some that are still struggling to get a transport to the health facilities, for instance, those in the border towns. How are you helping the parents in those particular areas?
We have worked with the district health officers and RDCs, and we are requesting these clients or caretakers, as they are coming to our facilities, they need to have our vaccination cards. So when you have the vaccination card, they are pre-positioned vehicles, police cars are available. So as they pass, you can stop them. But also when, of course, they don't allow border, but where there are challenges, I think the RDC can give a waiver. So we are encouraging people to contact the DHOs in case they are very far and they need transport. They can be picked.
All right. And maybe finally, what are your post-COVID plans for the immunization programs?
We are working with the districts to map out the sub-counties, parishes and villages that have been affected by the pandemic, by actually assessing the number of children that have not been reached. And we are going to use targeted strategies like periodic intensification of routine immunization, okay, to go to those particular areas. We are going to make deliberate efforts to go to those areas to ensure that those children are vaccinated. But we are also going to ensure that the daily vaccination activities continue, okay. We are going to ensure that the outreaches are regular and of good quality. And we are going to ensure that we continue doing our teleconferencing and remotely supporting those people who will be in the field to ensure that we reach out to all these children.
All right. Thank you so much for joining us in our studios tonight. That was Fred Nsubuga, Senior Medical Officer in the Ministry of Health, speaking to us about the immunization programs and how they've been affected by the COVID-19 pandemic and some of the strategies that they have in place to ensure the smooth running of the programs moving ahead. Thank you all for joining us.